is originally from Jamkhandi. Has completed his primary and secondary education from Jamkhandi. Sir has graduated from KLE Belgavi in the year 1984-85 and half year of a PG Emergency Medicine from Bangalore Medical College in the year 1987-88. Sir was a professor and Ayurveda consultant for 6 years in Terdal. Sir was executive committee member at the State Ayurveda Association. Sir was a visiting Ayurveda consultant to various institutions like KLE, Hubli and Bagalkot. Presently, Sir visits as an Ayurveda consultant at Sri Prasad Ayurveda Vijayanagar, Bangalore and Pranav Holistic Center, Hanumant Nagar, Bangalore on every second Saturday and Sunday. Sir honored as Best Ayurveda Practitioner on Raja Utsav Day in the year 2013. Sir received a Chikitsa Vaishishtya Award from KLE Ayurveda Mahavidyalaya in the year 2015. Recognized as Ayurveda Rasayani of Pune in the year 2018. Recently in Ayush TV, Sir presented evidence-based neuromuscular disorder on April 25. Presented and discussed regarding neuromuscular disorder with former Vice Chancellor and great physician Padma Bhushan Dr. B.M. Hegde ji. Sir is active member of Rotary for 35 years, serving as a president. Sir had an opportunity to discuss on Ayurveda in neuromuscular disorder with the scientist of AIIMS Delhi, Dr. Hiro Lokesh Yadav ji. Sir has done over 53 such as global delayed milestone, Down syndrome and many more. About Sri Vinayak Ayurveda Aspatre, where Sir is the Chief Ayurveda Consultant. This trust is actively working on providing comprehensive medical services, enhancing quality of life for an individual with disabilities, conducting medical research, educating the public, healthcare professionals and policymakers about congenital neurological disorders. This trust strides in treating over 2,000 individuals with various disabilities. The session is over to you, sir. Please proceed.
Hello. Good afternoon. Good afternoon. All you had the food? How about the afternoon nap? How about the afternoon nap? I'll not leave you to take a nap, okay? Respected Principal Sir and my co-speakers, staff, it's a great privilege for me to present my cases which I have treated so far, particularly in congenital neuromuscular disorders and neurodegenerative disorders with you all. The main question is ringing in my mind. Please settle down fast. Most of the people are having the question in their mind. Neurology is not a bite of my bread. So, let's keep it away. Yes, most of the people they think, yes, I have very good setup of a Panchakarma unit, so let me start a neurological disease cases. I am not doing any karma. The diseases so far I have documented about more than 50. It is only through Shamana Chikitsa It's only through Shamana Chikitsa. So if you have a space of 10 by 10, also you can run a very good Ayurvedic clinic. So long back, I have presented all the cases as a introducer has told in front of photos. Dr. Padmasri B.M. Hegde sir, and he has blessed me by sending about 8 cases and treated successfully. This is the first case. It is an anterior horn cell disorder, or call it as a MND. It is most of the videos are self-explanatory. Sound please. Just I will brief about the history. Age about 47. He came with a weakness in the arm as well as the wasting in the shoulders. Brief about the case because it is almost 7 minutes video, because I have to cover a lot of diseases. I think more than 25 or 45 diseases I have come with the videos. So this is the second video just after a month. He improved the wasting. The treatment part I will tell you, given only 2 medications. Suvarna Sindhura Kalpa that is 5 grams per day, and one more Smriti Vardhaka Rasa. These are the only 2 medications which I have given to him. Application followed by the hot water. Balashva Gandha Lakshadi Taila. Finish. No any other medications. Next video. Sir, this is a history of road accident. Immediately she went into coma due to the internal injury. Due to the internal injury, she went into coma. Operated in multi-specialty hospital at Davangere. And after 15 days, they asked me to visit the hospital. We asked them to take a permission of the hospital as well as the concerned surgeon. Went and consulted, taken the video. I have taken this video on 23rd of November 2024. When I practice this kind of, when I'm doing this kind of practice, I ask every patient to give me a 60 days, irrespective of the early span of the disease or present condition of the disease. In 60 days, they should find minimum of 10 to 20% positive improvement in all the areas. But here, I have assured them, looking at this present condition, I may expect more than 30% improvement. Let's see what will happen. Next video. This is after 1 month. On 7th day of my medicine administration, she regained the consciousness. This is the present condition of a lady. I have taken this video after 3 months. Audio, please. From the beginning. From the beginning. I have not done any special medication. The books which you all are using, the same book I have used. But our peers have given us a liberty to have our own recipe. ನೀವು ಅಡಿಗೆ ಮಾಡಿ ಊಟ ಮಾಡ್ರಿ, ಅದರ ಮಜಾನ ಬೇರೆ ಇರ್ತೈತಿ. Have your own recipe. And it will not happen over the day. It takes time. If you work sincerely, definitely you will achieve something. Good. Come on, next one. Please identify the disease. Sound. Start from the beginning and sound. Start from the beginning. Can you identify the disease? I want to make it an interactive session. This is Hika. She was suffering with Hika since past almost 6 years. Went under all possible investigations, all were normal. Next, continue the same. This is just after 10 days of a treatment. Okay. We have given the treatment for 35 days and we have stopped. The line of treatment, anybody? Kamadugdha, Pravala Panchamruta, Pravala Bhasma in Gunja Matra, morning with empty stomach, evening with empty stomach, followed by Dhanvantari Vati. Finish. No any other extra medications. Given it for 35 days. This is LGMD. Next video, ma. After 45 days. It's a limb grade muscular dystrophy. Might have heard the name. It's a progressive in nature. Again, it's a autoimmune disorder. It is a progressive in nature. Lifespan after diagnosing maximum 15 to 18 years. Earlierly, it was difficult for her to lift both the limbs, even the leg. Even she used to sit with a difficulty and she used to get up with a difficulty. Continue the same. age about 72, asked her to replace both the knees, go under spinal operation. She was suffering with the major problems since past 15 years. It was very difficult to sit even 5 minutes continuously. Run the video, ma. Given the treatment for 4 to 5 months and we have stopped, she is happy with 70% of the positive improvement. Gaining in this age about 70% improvement is something wonderful. Yes or no? No encouragement. See, when I practice all this, you all can practice. Only thing, you need to have your own recipe. You need to have your own recipe. You know what I have put inside. On that basis, I give a guarantee. If you don't find even 10% of improvement in your behavior or the total symptoms, please don't visit. ಯಾರು ಹೇಳ್ತೀರಿ ಬರಬೇಡ್ರಿ ಅಂತ ಹೇಳಿ, ಡಾಕ್ಟರ್ ಬರಬೇಡ್ರಿ ಅಂತ ಹೇಳ್ತೀರಿ ದವಾಖಾನೆಗೆ ಪೇಷಂಟ್ ಒಳಗೆ. ಎಸ್, ಐ ಆಮ್ ದ ಪರ್ಸನ್. ಐ ಟೆಲ್ it needs a continuous reading of the books and application. Our peers have nothing left to invent. They have given everything, given the liberty to have our own recipe, what I have told earlier. Next one. Again same, neurodegenerative disease, suggested for the operation. He is a CPI, police department. Advised to go for a spinal surgery. One thing I want to clear here regarding the documentation of the cases. You need to have a clearance certificate from the patient or the patient parents saying, I may use this video for the betterment of other people. They should not think we are using as a advertisement. So this is a first and primary thing. Simultaneously, ask them to give us the previous health records. Because whenever you go, if you show the cases, the other dignitaries may ask, how about the previous health records? So you need to show the health records also. If anybody wants to see, I have bought the bunch. The same case, we'll go for next one. Yeah, he has improved almost 100%. Age about 36, he has improved 100%. And in all these cases, I am using Rasoshedis on daily basis. Rasoshedis can be given up to how many days? Loudly, how many days? Please stand up, please. How many days? One mandala. Next. Anybody? But in all these cases, I am giving Rasoshedi on daily basis, years together, without any complication. Without any complication. How it could be possible then? In Padartha Vijnana, they have told Yukti Chikitsa. Based on the strength of the rogi and the knowledge of the Vaidya, the medicine can be given for n number of days. Do you agree with me? Sir? Yes or no? Kannu muchi use madri. Safe irbek. Compromise madkolangilla. Preparation dolgo compromise madkolangilla. Procuring the raw materials also, no compromise. Bhasmas particularly, you get Bhasma, Suvarna Bhasma for 8,000 rupees, also for 16,000 rupees. Adu yav togobeku annodanu ನೀವು ಡಿಸೈಡ್ ಮಾಡಬೇಕು. Once your name is lost, ಇಲ್ರಿ ಸರ್ ಅವ್ರ ಕಡೆ ನಾ ರಸೌಷಧಿ ಅಂತ ಏನೋ ಕೊಟ್ಟಿದ್ರು ತೊಗೊಂಡಿದ್ನಿ, ನಂದು ಯಾಕೋ ಲಿವರ್ ಏನೋ ಬಾದ್ ಆಗೈತೆ ಅಂತ ಹೇಳಿದ್ರಿ ಅಂತ ಯಾರು ಒಬ್ಬ ಪೇಷಂಟ್ ಅಂತ ಹೇಳಿದ್ರೆ ತಿಳಿರಿ, ನಿಮ್ಮ ಕರಿಯರ್ ಬಾದ್ ಆಕೈತಿ. By God grace, past 30 years, not a single case came, sir, with your medication my son is suffering or my brother is suffering with these problems. No, it's a God grace. It's a burning issue nowadays. It's a ASD or ADHD with autism. The patient is from Goa, age about 13 years, weighing about almost 92 kg. He was so aggressive. No gadgets left in the house, no glass particles left in the house, no switchboards. He used to hit, he used to bite. He was very aggressive. I'm going to continue. Next video. After almost 2 years of treatment, he became very cool. He used to respond for all the orders. He used to obey all the orders. And he is very good in singing. He sang a song in their school gathering. Also, he performed a speech on 26th of Jan in his school. We have stopped the treatment almost 3.5 years. He is fine. Last on photo there, Roma. Recently he has passed the SSC with good marks. Recently their parents have shared that photo. Photos there already. Yes, this is a SSC marks card, 10th marks card. Next. Because autism is nowadays a burning issue for metropolitan cities and foreign country people. Sanskrit terminology ಏನದರಿ autismಗೆ? It falls under what? Autism falls under which disease? Disease. Autism falls under which disease? All neurological diseases are fall under Vatavyadi. Doctor ಹೇಳಿದರು. Unmada. Do you agree? This autism is named as Unmadiya Swalinata. They never mingle with the people. Self-oriented. They never give eye-to-eye contact. There will not be any eye-to-eye contact. They are more attracted towards inanimates rather than the animates. The one thing common in all the patients, they are very much fond of salt. ನೀವು ಕೇಳ್ಬೋದು, ನಿಮ್ಮ ಮಗ ಉಪ್ಪು ತಿಂತಾನೇನ್ರಿ? ಹೌದ್ರಿ ಸರ್, ನಮ್ಮ ಮಗ ಉಪ್ಪು ಭಾಳ ತಿಂತಾನ್ರಿ. ಎಲ್ಲ ಪೇಷಂಟಿಗೆ. So here only two kind of medications. That on Kanchana Siddha Kalpa, 13 to 14 drops per day, finish. Another one is Smriti Vardhaka Rasa, 600 to 800 milligrams, morning and evening with honey. No other medications given. Can you diagnose the baby just by looking at the face? Just listen the words. Father is crying and I have given him a confidence. ನಾನು ಗ್ಯಾರಂಟಿ ಬದಲಾವಣೆ ಬರ್ತೈತೆ ಅಂತ ಹೇಳೀನಿ. After 8 months of treatment, the boy is walking. Even he is getting up from the floor on his own. Next one, next video. The boy is having muscular dysphagia, weakness in the trunk as well as the limbs. Facial expression is not that clear. Drooling was there. But all the symptoms have come down in 8 months, but we have asked them to give a treatment at least for 2 years. When you show the result, definitely the patients will follow your instructions. Don't be after money. You show the result, money will follow you. ಯಾಕೆ ನಾನು ಇದನ್ನು ಹೇಳಕತ್ತೀನಿ ಅಂದರೆ my 5 ml of medicine cost about 10,600 rupees. 5 ml cost about 5,600 rupees. ಇಷ್ಟು ಹಣ ಕೊಟ್ಟು ನನ್ನ ಕಡೆ ಏನು ಬೇಡ್ಕೊಂಡಾರ ಬರೋಕೆ, ಅದಕ್ಕೆ ಕ್ಲಿಯರಾಗಿ ಹೇಳ್ತೀನಿ. ಇಫ್ ಯು ಫೈಂಡ್ ಮಿನಿಮಮ್ 10% ಇಂಪ್ರೂವ್ಮೆಂಟ್, ಪ್ಲೀಸ್ ಕಮ್ ಆ್ಯಂಡ್ ಕಂಟಿನ್ಯೂ. ಅದರ್ವೈಸ್ ಬರಬೇಡ್ರಿ, ಏನು ಜರೂರತ್ತಿಲ್ಲ. Next. Shatakumbhadikalpa, again Smritivardhaka Rasa. Dosage 8 drops per day. It's a case of autism with again ADHD. We can see the improvement on the faces of the parents. ಅದಕ್ಕೆ ನಾನು ಹೇಳೋದು, ಅವರು ಕೂಡ ಹಣ ಎಷ್ಟು ನನ್ನ ಜೇಬಿನಲ್ಲಿರುತ್ತೋ ಗೊತ್ತಿಲ್ಲ, ಬಟ್ ನಾನು ಮಾಡಿದಂತಹ ಬದಲಾವಣೆ ಡೆಫಿನೆಟ್ಲಿ ಇಟ್ ವಿಲ್ ರಿಮೇನ್ ಇನ್ ದೇರ್ ಬಾಡಿ. He is also very good in singing. Next. It is a peculiar case. Undescended testis or testicular atrophy. In modern science, there is no treatment. Only option, operation. With Rasaushadhi. You can visualize both the testes. This first amatus. This is the second. The first photograph taken it on 12/10/24. Next one. 9/11/24. Next. 14/12/24. Next. 10/1/25. You can visualize both the testicles. Treatment is on. Baby is very happy. Next. Kanchana Siddha Kalpa and Smritivardak Rasa. Just I will brief about the case. It's a case of cerebral ataxia, age about 9, taken a treatment in n number of hospitals, even stem cell therapy has taken thrice with no result. This is after 60 days of treatment.